This is video education for the vascular band, compression band for post-op radial heart caths. You'll see that that X there is the insertion site where the sheath was removed. These bands are applied by cath lab in cath lab, and the patient comes to the floor. Typically about 13 cc's of air are applied into the air bladder, which applies pressure to that site to eliminate bleeding. It is our job as nurses at the bedside on the floor to monitor the site for bleeding and then also to remove this band safely and timely. There's two types of heart caths, diagnostic and interventional. For diagnostic heart caths, the band needs to be in place for 60 minutes before we start to release air. For interventional heart caths, the bands need to be in place for 120 minutes or 2 hours before we start releasing air. This is the vascular band plunger. One unique thing about this is the safety stop here, this little white piece here. As you can see, I'm turning the plunger itself. When it's put into this safety zone, it only allows 2 cc's of air to be drawn back at a time. So if I pull back, it stops me at 2 cc's. If that lock is not in place, I turn the plunger the other way, I'm able to pull all the way back. So if I was to apply this to an inflated vascular band, the potential of it taking all the air out is high. So that's why when we're reducing air, it's important to turn that lock on and make sure that you're only pulling back 2 cc's of air at a time. So let's say that this heart cath here was a diagnostic. I've waited my 60 minutes or 1 hour, and I'm now ready to start releasing air. I'm going to make sure that my plunger is in the safety 2 ml release zone. I'm going to apply, twist on my plunger here, and you're going to see it's going to take back 2 cc's of air. Remove it. I'm going to wait my 5 minutes. We release 2 mLs of air every 5 minutes. While we're waiting, we're going to watch that site for any type of bleeding. If bleeding does occur at that site, we simply reinstill the 2 mLs that you just taken out, and you wait 30 minutes to proceed from there. Once the band is replaced, an occlusive dressing is usually applied. If there's any type of oozing or peripheral ooze at all, we can also apply what's called Silverstat. This is a new product that will be stocked on the floor. It has a silver hemostasis pad, silver nitrate built into it. You can see there's a silver side. That side goes face down onto the site to help with that oozing. If there's actual bleeding at the site, we need to reapply the compression band and notify the physician immediately and document that. That is an adverse outcome. We recently experienced a hematoma here at Fremont Health, and that's why we're doing this education now. Also, for post-op heart caths, radials, it's important that you have a pulse ox on the index finger to make sure that you have a good pleth and you're getting good oxygenation to this extremity despite the compression band being placed. Patient teaching is also very important. You want to educate the patient to decrease the movement of that hand and not to lift anything more than 10 pounds for that first day or so. More live education will be provided at that time. If you have any questions, please feel free to contact your clinical leader, Bobby Johnson.